What is hyperthyroidism? What is hyperthyroidism is a very, very common Gphc exam question. And what it's going to give you is, okay, so when it comes to the T3 and T4 levels, what is hyperthyroidism? What it is increased T3 and T4 and lower TSH. The way you remember that is T3, T4 is inversely proportional to TSH. Also, when we talk about TSH and T3, T4, you need to take into account amiodarone. If you have thyroid issues when taking amiodarone, you need to monitor the TS. So you need to do thyroid function tests more frequently and you need to increase the monitoring. It's kind of a similar concept to warfarin. If you have warfarin and tramadol together, which can increase sort of bleeding, this interaction will mean that you need to monitor INR more frequently. And this is a very, very important point. When it comes to warfarin, you need to understand that interacts with most things. So this is a very important point. So another additional issue is low molecular weight heparins. Low molecular weight heparins are safe in pregnancy and breastfeeding. And this is an important point to talk about. As when we deal with DOACs, like with riroxaban, apixaban, or even adoxaban, an important thing is some of these don't have reversal antidotes. An example is adoxaban. Adoxaban has no antidote. None. So this is a crucial point because if you have digoxin toxicity or overdose, right, where you may get yellow-green halo vision or bradycardia, what would you give the patient? You would give them Digifab or Digibind, so digoxin antibody. And an important point is the GPC will love to ask about is if a patient has unfortunately overdosed on the medication, it could be for whatever. They may unfortunately be suicidal. They might have suicidal ideation. Like for instance, if a patient is on montelukast, right, you know, or you should know by now that montelukast, which is used for asthma for a patient that's under 12 years of age, you can have changes in neuropsychiatric reactions. And for that reason, that could lead the patient to unfortunately have suicidal ideation. So would want to unfortunately end their lives. And you know, this is very sad, but you must know this for the exam. So which drugs will cause neuropsychiatric reactions? And there's a few of them, you know. An additional point is methotrexate. You know, you take methotrexate weekly, but you also give folic acid because methotrexate has antifolate activity. So methotrexate and trimethoprim, which both interact together and both have antifolate activity, you need to be careful. Now, the way you remember that is when a fetus is growing in the stomach of the mother or the uterus or whatever, folic acid is essential for organ formation. So any drug that affects folate activity or is an antifolate will affect the organ formation in the child, which will lead to congenital malformations. And this is why you have issues of, let's say, spina bifida or neural tube defects in babies. You know, for instance, warfarin is embryo pathogenic, and you shouldn't give it when a woman is pregnant for that reason. You know, you can have warfarin syndrome, warfarin baby syndrome, which is an actual syndrome. So yeah, watch out for that and definitely focus on the drugs that are teratogenic or can affect teratogenicity. And watch out for that in the exam. And thank you so much.